Good afternoon, my name is Dr. Lindsay Hamilton, and today we want to demonstrate a technique that we use at our clinic to break up scar tissue and to free up frozen shoulders. Miss Sam has had a right shoulder injury for over 20 years, and they have her raise her left shoulder up as high as she can go. That's normal range of motion for her. And now the right side, you can see how it's kind of locked in place. So the technique we use is called the Gratson technique. We have different tools that can get into these little nooks and crannies and break up the scar tissue. So we're going to take our tool and get into the area that was injured. Now Miss Sam, you can look at her face. She's going to be showing a little grimacing because it is a little bit sore and tight. So the best way to understand the scar tissue forms from an injury or from repetitive motion. It goes into joints, it goes into muscle groups, and it restricts the normal range of motion. So this tool basically takes that scar tissue and breaks it up and makes it like normal tissue. Scar tissue, the best way to describe it would be it's like a steak that has a bunch of gristle on it. It's just real thick, doesn't move very well, and it just kind of locks up these joints. So we're getting it in there, we're moving this around, and what I feel is kind of a crunchy, grindy feel, and that is scar tissue. Down here, this is normal tissue. I don't feel as much of that. So we get into this joint, move back and forth. Again, sometimes this can be a little bit sore, but with ice and rest, usually feels a lot better afterwards. How's that feel so far?
Good.
She's being very polite. This is kind of sore. I know it hurts a little bit, but again, our end game is to reverse this shoulder injury that's been over 20 years. So we've been doing this for about 45 seconds, almost a minute. The regular treatment time is about 7 to 10 minutes. But for the sake of the length of the video, we're going to stop. I'm going to have her again raise this left hand up. That's normal range of motion. We can see this side, raise it up as high as you can. And down, that's maybe about 7 to 10 degrees improvement compared to when we first did it. So this is usually done about intervals of 3 times a week. We'll do that for about 6 weeks. At the end of that, this shoulder will be back to where it should be. This is Dr. Lindsay Hamilton, Main Street Chiropractic Wellness Center.